Okay, so if you're a nursing student, you know there's one last big hurdle after graduation, the NCLEX. It feels like this huge final test, but it's really asking just one thing. Are you ready? So in this explainer, we are going to break down exactly what you need to know to walk in there and absolutely conquer it with confidence. I just love this quote because it really gets to the heart of what the NCLEX is all about. It's not supposed to be some scary gatekeeper. Think of it as a rite of passage, you know? It's that formal step that takes you from the classroom to the bedside, turning all that theory into real hands-on patient care. And that's the million-dollar question, isn't it? The lead-up, the mountain of books, the pressure. It can feel like a lot, but I promise you the path to get there is way clearer than you think. It all starts with really understanding what the exam is actually looking for. And this, right here, is probably the most important mindset shift you can possibly make. The NCLEX is not about knowing every single fact in the textbook. Its entire purpose, its core mission, is to make sure that you can make safe decisions for your patients. It's a test of your judgment, your reasoning, not a test of perfection. All right, let's dive into the details, starting with the next generation NCLEX, or the NGN as you'll hear it called. There's always so much chatter about exam changes, so let's just cut through all that noise and get right to what you actually need to know. You heard that right. Let me say it again. If you've heard all these crazy rumors about a massive overhaul coming in 2026, you can just take a deep breath. It's not happening. The people who make the test have confirmed that the core of the exam, the stuff you need to know and the score you need to get, is staying the same. Here, let me show you the proof. So just look at this table for a second. See those percentages in the 2023 and 2026 columns? They are identical. The weight of every single category is staying exactly the same. The passing standard isn't changing. The only tiny little tweak is a title update for safety and infection control to emphasize prevention. So what's the big takeaway here? The stuff you're studying right now? It's the right stuff. So if the content is the same, what does next generation even mean? Well, it's all about how they're testing you. The whole point of the NGN is to measure your clinical judgment. Can you see the big picture? Can you figure out what's most important? Can you make good decisions when things get stressful? You know, just like you'll have to do every single day on the floor. This is literally the blueprint for how the NGN is built. And it's not some random academic theory. This is how great nurses think. You notice things. Those are your cues. You figure out what they mean. That's your analysis. You decide what the most likely problem is, come up with a plan, do the most important thing first, and then you circle back to see if it actually worked. Every case study on that exam is designed to walk you through this exact same thought process. Okay, so knowing how the test works is one thing, but actually getting ready for it is another. So let's talk about a super simple but incredibly effective way to structure your studying. It really is simpler than you'd think. One nurse who passed on her first try, totally self-studying, said it all comes down to just two things. Yep, that's it, just two. And here they are. Step 1, do practice questions every single day. No excuses. She aimed for at least 60, but often did more. And step 2, and this part is maybe even more important, study every single question you get wrong. Don't just glance at the right answer and move on. You have to dig in and understand why you got it wrong. The reason doing questions every day is so powerful is because you're literally training your brain to solve problems. It's like building muscle memory. The NCLEX is basically one long simulation of being a nurse, and doing these questions builds up your mental stamina for the real thing. And this is why you should almost get excited when you get a question wrong. Seriously, every mistake is a golden opportunity. It's where you learn how to prioritize, where those safety principles really click, and where you start to understand how the experts who write the exam think. This is where the real learning happens. But look, you can have the best study plan in the world. And it won't matter if your head's not in the right place. Your mindset, how you deal with stress and setbacks, that is your most powerful tool. This idea is an absolute game changer. A growth mindset, a term from psychologist Carol Dweck, is basically the difference between saying, I can't do this, and I can't do this yet. It's believing that hard work makes you smarter and that challenges are just opportunities to learn. It's the perfect mindset for nursing school and especially for the NCLEX. And you build that mental strength by taking care of your whole self. You're not a studying robot, right? You're a person. A study actually found that student success is built on these 5 pillars. It means getting enough sleep, going for a walk, having someone to call when you're overwhelmed, and even planning out your budget. Taking care of all of you is a key part of preparing. Okay, so you've done the work. Your mind is right. Now, let's talk about the final step, how to perform your best on game day. Here's your checklist. Get there early so you're not panicked and rushing. Read every single word of every question. The details matter. And please, please use your breaks. They are there for a reason. And probably the biggest thing, do not get obsessed with how many questions you're getting. It's a waste of mental energy. Here's why you can't worry about the question number. The test is adaptive. That means if you get a question right, the computer gives you a harder one. Get one wrong, it gives you an easier one. So this might sound backwards, but if the test starts to feel really hard, that's a fantastic sign. It means the computer sees that you know your stuff and is challenging you at a higher level. And this is what it all comes down to on test day. This is your mantra. Don't think about the last question you answered. Don't worry about what's coming next. Your entire universe needs to shrink down to the one single question on that screen. Give it your full attention. That's it. In the end, after all the studying and the stress, it all boils down to this one question. Are you ready to be a safe nurse? Passing the test isn't the finish line. It's the starting line. The real journey, the real honor of caring for people, begins the moment you step out of that testing center and into your new life as a nurse.